there is new shaming that is going on. We were just talking about Ozempic a few minutes ago. Now there is kind of a trend, as sad as it is to say, of people who are using Ozempic being shamed as, I guess they talk about the fact that they're on it as they're using it to try to lose weight. A little more on what's going on here and some of the side effects of Ozempic. David WIOD is a doctor at Holy Name Medical Center. Dr. WIOD in New Jersey, right?
Yes. Good morning,
yes.
Andrew.
Good morning.
New Jersey.
Yeah, thanks for being here. So, there's been so much coverage of Ozempic, and then this morning they're reporting that there may be an Ozempic pill that is being developed by the drug maker and other things that are coming out. Start with the psychological part of it, and I realize you're a heart guy, but the psychological part of what I would imagine people actually going online for whatever reason, talking about it, and then being shamed for using it for weight loss in the medical field. I mean, is there a term for this? Is this of concern?
I mean, it is a major concern. To begin with, a lot of these patients with that are overweight or obese are already dealing with the stigma of that medical issue because people, think about it for a second. When you look at somebody, you have no idea if they have high blood pressure, high cholesterol, or diabetes, but when somebody is overweight, you know right away that they have that medical condition, and there is this judgment going on already because there's this misconception that if you really, really try, you can lose the weight right away, and that it's some sort of lifestyle choice that these people are making. But now, to make matters worse, when a patient finally resorts to using a medication and treating that medical condition, they are then told that somehow they're cheating and they're not losing weight the correct way. So this is, there's a lot of fear going on with these patients that they try to hide it. They don't want to admit to other people, their friends even, that they're taking these medications to lose the weight, even though they're really doing the right thing.
So in a world where there's so much, at least in our country, based on medical privacy, does it strike you as being, odd may be the wrong word, but I can't think of a better one, that people would in fact be, in the normal course of just talking to friends or anybody else saying that I'm on Ozempic or any of the others that are, out there doing the similar sort of thing? To your point, why not just keep it quiet, and if it works and you lose the weight, deal with it at that point?
I mean, I think it's a personal decision that everybody has to make. I mean, some people are very open about, the blood pressure medications that they take or the cholesterol medications that they take, and it's a personal decision however you choose to lose the weight, whether it's with diet and exercise, whether it's with bariatric surgery, weight loss reduction, whether it's with medications. I think it's a personal decision, but what I am seeing now more than ever is that patients are scared or fearful of what the repercussions might be with their friends or other people if they admit that they're using a weight loss medication.
Doctor, I'm going to have you put on your cardiology hat here for a second. We talk about, I guess, the upside of Ozempic and the others seemingly all the time now. Are you personally seeing any of the other side of that, some of the negatives, some of the side effects, as it may relate to heart health or anything related to that?
Of the medication itself, or
no, of the medication itself.
So I think the medications have been very well proven in reducing the risk of heart disease. So the benefit of being on these medications and losing the weight is definitely there from a cardiovascular perspective. We are seeing the most common side effects you get from these medications are gastrointestinal, like digestive in nature. So most people will have to stop the medication because they're experiencing nausea, vomiting, diarrhea, constipation, things like that. But heart issues, it's actually beneficial in these patients to take the medication and lose the weight.
Real quickly here, and this may be kind of an out-of-lane question for you, but there's been a lot of reporting on social media, people saying supplements have the same effect and encouraging people to take huge amount of supplements. I don't want to put words in your mouth, but I would imagine as a medical professional, that's probably not a great idea without checking with your own doctor.
That's a great point. I agree with you completely. So I think you have to really be careful whatever you're putting into your mouth besides what's controlled by the FDA. It's important to remember that all the prescription medications we use have been backed up by multiple trials, right? But all these other supplements, nobody really knows what's in them. They have not been backed up by trials. The FDA doesn't control what's in them, so you have to be very careful what you're putting into your body.
All right, Dr. WIOD, I really appreciate your time. We'll speak with you again soon. Dr. David WIOD at Holy Name Medical Center. That is in New Jersey. He's a cardiologist and clearly a subject matter expert on a lot of what's going on with Ozempic. All right, 8:27, quick sports check again. Here's